call has just come through from paramedics, rushing in a man who's been stabbed in a violent attack and could be bleeding to death.
So let's get the room ready. We're going to go into trauma 1 or 2? Trauma 1. So we know that there's a man who's coming in police custody, who's been stabbed on the left-hand side of his body. And we anticipate that things might kick off in terms of not wanting treatment, not wanting to be there, being scared, having pain.
The man is under the influence of alcohol. He's extremely agitated and police are standing by.
Back out. Ready, set, go. Okay. He says he was stabbed twice. Not sure where it happened. Went home. Difficult to assess the depth of his wounds. He's reluctant to take close. He's got significant thoracic pain. Says it's sharp. Says he stops him taking a deep breath.
The man waited 2 hours after the attack before finally contacting a family member who convinced him to go to hospital.
I'm going to lay him flat. Let me have a look at his heart. I don't know if the stab wound's gone into his chest or his tummy. And so that's why we're trying to get the ultrasound and figure out if he's bleeding internally. Once I've done the ultrasound, I'll sit you up, matey, okay? I just want to get an ultrasound of you, and I won't do that for long. No, let me... To be able to figure out if he's got bleeding within his abdomen, we need to lie him flat. I'm really trying hard to get him to trust me, but this patient's really agitated, and so that is proving really difficult.
Just move the chair up, please.
You want to go up a bit? All right, no problem. How about that? Maddie, I want to let you know why I want to lay you down. Because the ultrasound only works if you're laying flat.
Give me the morphine.
I'll give you the morphine, and then what I'm going to promise you...
water, please, mate.
I'm going to get you something to suck on in your mouth.
Drink, please.
This man has a lot of pain with breathing, and so I know that things have gone deeply into his body. I just can't figure out if it's into his chest or his belly. He is really scared, but I'm realising that he doesn't understand the severity and the life-threatening nature of the stab wound.
I can't lay down, I'm telling you, it hurts.
We'll give you some medications.
There's much pain there when I go down. Please take this off.
And I don't know who stabbed him, but they'd stabbed him such that he could bleed to death.
Next waiting.
The Royal Melbourne Hospital is home to one of Australia's biggest and busiest emergency departments.
So, what am I doing? I've got bed. He's going to the neuro. ICU, looking good.
It's Dr. Mark Putland's job as director to make sure the more than 200 patients a day get the critical care they need.
I'm very proud to work in emergency here. It's a fantastic place and just a fantastic team to work with. And the emergency department suits me well because it makes order out of chaos. In a place this size, yes, every day there's something big.
Dr. Mark and his team have just been alerted to an incoming patient with severe injuries. 23-year-old Zach has been in a horror workplace accident where his right hand got trapped in factory machinery.
Oh, my God.
The glove of his pinky finger got caught in the rolling machine. Then he felt his hand go up and under through it. He says that his fifth finger was completely amputated. The other two are completely degloved down to the bone.
By the time paramedics arrived, Zach's workmates had already bandaged his badly injured hand.
I don't know if my pinky's gone.
Your mates put it all in a bag for us.
Me put my pinky in a bag.
Put his pinky in a bag. How do you feel about it when you cut the t-shirt?
I've lost my fingers. I don't care at this stage.
The emergency team must move fast. The priority is to prevent blood loss and infection, which causes damaged flesh to die.
What do you do for a living?
I make doors. Not anymore.
All I know at the moment is a young man has put his hand into a machine or something. He's lost a lot of skin and tissue off his fingers. One of my colleagues is in there with him at the moment. I'm just going to go and see how he's going.
Arm's your best bet from what I understand.
G'day. Zach, I'm Mark.
Nice to meet you, Mark.
One of the other doctors. You've got a lot of doctors. You'll meet a lot of us today. You've had a bit of a...
Popular right now.
Yeah, you're pretty popular right now. You don't have to be popular with doctors if you can avoid it. You've had a bad morning. What happened to you today?
Cleaning a glue roller at work.
Yeah.
Glove got caught in the roller.
Yeah, okay.
That was,
That was it. Did you get yourself out, or...? Yeah, good.
It was getting feet up against the thing and pulled as hard as I
seriously?
could. It was that or I lose my hand. It was just... I'd like to say quick thinking, but it wasn't quick thinking because it was the only option. But it was like, if I'd left it any longer, I don't know if I'd have a hand necessarily, so I got lucky. As lucky as this can be.
Zachary reacted pretty quickly. He put his feet up against the side of the machine, just pushed hard, pulled himself out, which was a life-saving decision. You've done well. You've saved your own life there. He left behind a good deal of tissue from his fingers and, I mean, potentially hand-losing injury.
What the doctors can do to save Zach's hand will depend on what they find under the bandage.
Sorry, mate. It's
Do whatever you got. Holy
Hello, Michelle speaking. Yes, serious blood pressures. Yeah, that's fine. I can order that.
Dr. Michelle Thornhill has been an emergency physician at the Royal Melbourne for the last 5 years. Her first job was a baptism of fire.
Back in the Caribbean, the first job I got was in the emergency department. And on my first day, a bomb went off in the capital and we were flooded with patients with injuries from this bomb, and it was organized chaos that really got the adrenaline flowing. And from that point on, I said, emergency medicine is definitely for me.
Dr. Michelle's next case is 30-year-old heavily pregnant Freya, who's been brought in experiencing extreme pain from a badly dislocated shoulder.
How many weeks pregnant are we? 31 and a half, all right. On my side. Yeah, you can go whatever's comfortable for you, okay?
Freya's mum, Janet, is by her side. She's anxious because her daughter is soon to give birth to twins, and any medication Freya may need could harm the unborn babies.
She is my only child. It's awful just being around when your child's in pain.
Get the hand over, see what's happening.
Freya's a 30-year-old female. She had a right shoulder dislocation about 4 months ago, was cleared to exercise. This afternoon at about 2 o'clock was swimming in the pool. She's felt it come out, felt it pop. She said that she's aware of the sensation and the discomfort due to the history of the recent dislocation.
After a quick swim, Freya was to have a special night out with her mum to see Harry Potter the stage play. But now, their plans are in jeopardy.
Freya, hi there. My name is Michelle. I'm one of the emergency doctors. From what I heard, this has happened once before, about 4 months ago.
Yeah. I've been seeing a physio.
Okay.
Who gave me the go-ahead to swim. I have been swimming a bit.
Okay.
But can I get something?
Yeah, definitely. Shoulder dislocation. It's that really acute, severe pain, and it just fires the nerves. So everything around there is really angry until it gets back into place. And while she's in this much pain, the babies will be feeling the distress that she is in.
To put her dislocated shoulder back into place quickly, the team need to sedate Freya. But giving pain relief to a pregnant woman is risky because the babies will be affected by it too.
Take a big breath in, okay?
Slow, deep
all the
breaths.
way in for me.
What I like to do is use the least invasive method first. Nitrous oxide's fairly simple, laughing gas. A lot of people know about it. It is used in pregnancy. Are you going there, Freya?
Dr. Michelle hopes the nitrous oxide will give enough pain relief so they can pull Freya's shoulder back into place.
Squeeze, that's it. Yeah, you can squeeze as hard as you want there. I think Freya right now is out of her mind. It's severe pain. I think she's probably thinking this is worse than the labour she's about to go through as well. Right, now.
All right, I'm letting go.
The nitrous oxide isn't enough to deal with Freya's pain. Her arm's still dislocated, so Dr. Michelle makes the tough decision to use an intravenous anaesthetic.
I'm gonna just put that oxygen back on. What we'd want to do is give her the smallest dose possible, just enough to relax her, make her feel comfortable. If we give her something too large, just like anyone else, it'll relax her totally. It will stop her from breathing.
And if that happens, Freya's unborn babies would be deprived of oxygen, putting their lives at risk.
Holy
Factory worker Zach is in shock after seeing his horrific injuries for the first time.
I'm not to look at it because it makes it worse, right?
Sorry for swearing.
The skin and flesh were ripped from his right hand when it got caught in machinery.
It's a devastating injury and a terribly frightening event too for a young person, for anybody. Some people really feel like they need to see it, and it's their body. They're going to have to come to terms with it sooner or later.
Do I have a pinky? Yeah. I do? All right, well, that's...
You still with us?
Yeah, I'm wide awake. I'm not going to sleep anytime soon.
As doctors assess the extent of the damage, Zach is only now beginning to process the enormity of what's happening to him.
They're gone. What are the chances of me keeping my fingers?
I mean,
pretty low.
It'll be a lot of operation,
yeah.
I'm going to be honest, okay? And in terms of what we have to do, in terms of functionality after all the operation, it's going to be very... It'll take a lot of rehab to get to a functional level.
Yep.
Great, yeah.
Just do what you guys need to do.
Yeah.
All good.
He's got a tough time ahead. A lot of it will depend on which fingers he loses and what kind of mentality he's got too about life. Some people will, just really hit a dead stop with this sort of thing for years and really struggle to recover. Other people lose a lot and get on with it. We don't know what's in us really until it happens.
So it was only my fingers that are broken. Yeah.
I think just the fingers that are affected. I did hear them say that the bones and the tendons were intact.
Yeah, that's what they said.
There's a lot of extraordinary things to be done by the plastics teams with grafting skin and tissue on from other parts of the body. But the longer things are exposed to the outside world that aren't meant to be, like bone and nerve, the more infection is likely to set in, and infection will really be the enemy of successful salvage of that hand.
Once I've done the ultrasound, I'll sit you up, Maddie, okay?
In Trauma Room 1, Dr. Emma West is still trying to assess her aggressive patient who's under police guard. The stabbing victim was attacked with a long blade and may have life-threatening internal bleeding. Surgeons are standing by, but they need conclusive ultrasound results before operating.
My hand, you can squeeze if you like.
Go back up.
We will in just a second, okay?
Hold on.
Some pictures, yeah.
There's a little bit of free fluid there.
Oh, mate, please.
So there is a little bit of free fluid. All right, matey?
Yeah. It's a job.
Hey, mate, I reckon you've been stabbed in the belly, and I reckon it's popped into your tummy, and I reckon it's bleeding. You'll get sick and die if you don't have an operation. We're going to knock you out for an operation.
Give me a drink first.
No, not at the moment. We can't do the operation if you have water in your stomach.
I'll give you some ice. Here you go.
I want ice.
All yours.
The team deny the man a drink, as the fluid could end up in his lungs and he could choke to death.
I just need a drink and I'll wait. I'll help me
I'm
out.
happy to give you ice. There isn't anything else we can do.
Just give me a drink.
The patient is becoming increasingly aggravated.
If things get out of control, we have to be careful for our staff's safety to make sure that everyone's safe and the patient's safe. I know he's been stabbed and I know he's bleeding internally and I know that he's not able to make the right decisions for himself, and so my job is to take control of the situation, so take the choice out of it for him.
Dr. Emma makes the decision to sedate him.
I'm giving you some medication through the drip, okay? It's called ketamine. Have you heard of that before?
No.
It makes you feel a bit weird, but we're here to look after you, all right?
I'll be gone in a minute.
Hope not. We're here to look after you, mate. This man needs sedation and he needs a drug that won't affect his blood pressure and heart rate. So I've given ketamine. You just relax. I'm just going to lean you back a little bit. Not too far.
Good.
I've gained control of the situation now, but I get the feeling that I can't just relax.
Down like
All right, yeah. All right, coat break, please.
Over in the resuscitation unit, heavily pregnant Freya is still in excruciating pain after dislocating her shoulder.
We will drop some fentanyl.
Dr. Michelle Thornhill has been forced to sedate the 30-year-old with intravenous anaesthetic. But there could be serious implications for Freya's unborn twins.
So this sometimes stings just a little bit going up the arm. There is a risk with anaesthetic, and it is a fine balance to get you just relaxed enough, but breathing on your own so we can get things done, and a little bit more, and you go to that point where you stop breathing.
It'll be a few minutes before the anaesthetic can take effect. Mum Janet is still hoping they can make it to the stage play they bought tickets for several months ago.
Do you live in Melbourne?
No, we're both visiting to go and see Harry Potter tonight.
Oh, exciting. Oh.
So you think it's a possibility to get this?
We'll see. We'll try our best. Could you open your eyes for me?
With her patient now asleep, Dr. Michelle watches Freya's vital signs closely. Any change to blood pressure or heartbeat could signal the babies are in distress.
For a joint like your shoulder, all we do is gentle, controlled traction. Doesn't need to be too hard. Oh, that looks much better. There we go. Done very well. So her shoulder's looking good. Much better, not deformed anymore. You did really well. How's your shoulder feel?
With the shoulder back where it belongs, the young mum comes out of anaesthetic with a major concern.
I'm making an ultrasound just to check that there wasn't any impact.
Freya was obviously wanting to see a bit of movement because she couldn't feel it, babies.
Freya's desperate to know if the anaesthetic has affected her unborn twins.
I'll get the ultrasound around, yeah, and we'll have a look. Okay.
You just relax. I'm just going to lean you back a little bit.
Down like
All right, coat break, please.
In Trauma 1, Dr. Emma West has called for urgent help with her out-of-control stabbing victim.
down like it.
So I need you to hold him down. So I'm going to give him a couple of milligrams of Medaz. I think he's having emergence reaction from the ketamine. Now, you hold his arm down. Where's that Medaz? Good.
It's taken 6 security staff and police to restrain the aggressive man.
When he jumped off the bed, I screamed out for some help, called a code grey, and I knew that would result in security staff who are expert trained at helping me hold down a patient like this so that I can give him sedation so that he can get urgent care that he needs.
You've got 10 and 10 there.
Thank you. It's all right, it's okay. He's an injured man. We just need to be really safe with him. And he's had some medications that have... Excuse me? He won't listen to you. Because he's really sick. So I need to put a drip in there. So hold him there and hold that arm out. Good, thank you.
The sedation is beginning to kick in, but its effects will only be temporary.
So I think if we wait for his sedation to wear off, he's going to wake up and just be really, really difficult. So I think we need to get control of the situation. We can't reason with him. We can't get him to lay flat. We can't get him to do what we need. So I think we're going to have to intubate him now. You've got theatre ready?
They are aware.
OK.
In order to keep the man unconscious, Dr. Emma decides to take over his breathing and put him into an induced coma.
I was trying to meet him and talk to him so that maybe he felt that he had an ally, but his brain wasn't working that way because drugs, alcohol...
I can see untitled trace.
Yeah, there is. I see that.
Yep.
With the patient now under control, Emma's job is done. Whether he lives or dies is now in the hands of the surgical team.
I think you should start rolling. And there's lots of blood in his belly.
As he leaves the emergency department and heads upstairs to theatre, Emma's intense shift ends with paperwork before she can clock off.
My drive home is a little bit of wind-down time. Things percolate through your mind. You think about the case for a bit and you think, could I have done that differently, or did they get enough pain relief? So it's just that 45 minutes I find so important, because then I walk into the whirlwind of 4 kids all wanting my attention as soon as I walk in the door. And, you know, I'm their mum, so I have to be 100% ready for them too.
It's late afternoon and an air ambulance is arriving from country Victoria with a seriously injured car crash victim. The injured man is one of more than 500 patients airlifted to the Royal Melbourne Hospital each year.
Got it? Nice and slow, guys.
23-year-old Jack was trapped in his ute for nearly an hour, and paramedics suspect he has fractured bones and a dislocated hip. So treating him is time critical.
What's his name?
Hi, Jack.
Hi, Jack. I'm Jason. I'm one of the doctors.
Hello.
So I'll be looking after you today.
Dr. Jason Gabriel Anasaur needs to quickly assess if Jack's injuries are life-threatening.
Everybody ready?
This might hurt a little bit, okay?
Ready, set, go.
Good work, Jack.
It's just my hip.
This is Jack. He's driving on a 100k zone area in an older style ute. Has left the road and hit a large post, hit it head on. Trapped in the vehicle for a prolonged period of time. When we finally got him out and onto the stretcher, basically his left leg was extended up in that position.
And can you remember what happened?
When's that?
In the accident. You've had a car accident, so you've been brought by helicopter to the Royal Melbourne Hospital.
Oh, you're kidding.
So you can't remember anything?
No.
All right. First thoughts, the obvious thing is he's got hip pain, so he's got potential for internal injuries. We'll get some x-rays now to have a look at that left hip where he seems sore and he can't really straighten, to look and see if he's broken anything or if he's dislocated anything. If this hip is dislocated, Jack.
Feels all right.
So we're gonna give you some medication to make you a bit sleepy so that we can pop it back in, okay?
Putting a hip back in place is a difficult and risky procedure. So Dr. Jason calls his supervisor, Dr. Maya Kubert, to meet him in trauma for help.
The man in trauma 1 has got a dislocated hip.
Unlike Freya's shoulder dislocation, which needed gentle realignment, Jack's hip may require brute force, and there's a real danger of further injury.
Right. This looks unhappy to me. We are looking at an X-ray where his hip is clearly dislocated, but he's also had quite a significant injury where he's been in a car accident, he's had a period of time entrapped in the car, so we know we need to pull this hip and put it back in, but what we don't know is there any other injury that we will potentially make worse?
Oh my God.
It's been 2 hours since Dr. Mark Putland's patient, factory worker Zach, arrived at emergency. The 23-year-old ripped the flesh from his hand while pulling it free from heavy machinery.
You've done well. You've saved your own life there.
What are the chances of me keeping my fingers?
Zach's workmates recovered his skin and saved it in a plastic bag.
Pretty good, actually.
That quick thinking means Dr. Will Alexander and the plastic surgery team may be able to graft Zach's skin back onto his fingers.
Plastic surgeons need to do a lot of work with this because they want to try and salvage as much useful limb or whatever as they can, especially with hands. Any finger segment that's salvaged is an advantage to the patient.
Take the piece of skin and see if we can find some arteries and veins within it to put it back up to yours. Given the mechanism, it's probably unlikely we'll be able to do that when they get ripped. And if we can't do that, we actually just make a little pocket in your tummy skin, bury your fingers in that, and leave that there for 2 or 3 weeks, then gradually divide fingers at a time.
True. That sounds cool.
Yep, so that's another option. It's a bit more old-fashioned, but it works.
Whatever, man. Try and save me fingers, please.
We're going to throw the kitchen sink at you and try and do what we can.
Please do.
Zach will be on his way to theatre soon, where surgeons hope they'll be able to reattach his salvaged skin.
I'm going to take your fingers up and start having a look at them under the microscope now. Okay? I'll see you up there. Okay, good man.
As Dr. Will heads upstairs to prepare for surgery, Zach's family arrive to offer support.
Thank you for coming.
It's an overwhelming and confronting reunion for Zach's mum, Linda.
It's very lonely being a patient. You feel uncertain about what's going to happen. You have to make a lot of decisions. People come and talk to you about a lot of things you've never given any thought to before.
It's just such a surreal.
It's really nice to have someone who cares about you around. It makes a big difference.
All right.
We're off. We're going. Stairs.
Okay, I'll see you later, Zach.
Love you all.
Love you too.
It'll be up to the plastics team now really do what they can to salvage his hand or as much of it as they can. It might take a number of operations to conclude the whole thing.
Have you had any alcohol or other drugs today? It's not a problem. I just need to know so that I can give you the right things. Okay.
I had a beer last night before bed, that was it.
Back in Trauma Room 1, Dr. Maya Cubitt is assessing 23-year-old car crash victim Jack after his ute slammed into a pole. He's been given pain relief, but his dislocated hip needs urgent attention.
So the hip is this little ball that sits inside a socket like that, and yours is sitting out. It's a really common thing that happens when the dashboard pushes against your knee, pops it out the back.
Feels like a prick of a thing.
There is always a risk in a hip dislocation that if we don't manage it in a timely fashion, the part of the body that has been moved is at risk of not having enough blood supply to remain viable. In other words, the bone dies. All right, so CT first.
Okay.
Before attempting to pull the hip back into place, Dr. Meyer needs a detailed scan to make sure Jack has no other internal injuries.
We don't want to try and pull it. If there's any chance, we will move things around or damage his pelvis.
Looks like he's taken a chunk off of his femoral head.
It's bad news. The scan reveals Jack's thigh bone is fractured.
Which could make it a bit trickier to try and pop it back in.
Jack's returned to the trauma room where he can be sedated ahead of the procedure.
All right, Jack. Gonna drift you off to sleep now, okay?
In a patient like this, who's young, healthy, with large muscle mass, we know going into it that it will require a significant amount of sedation.
Good idea.
Started, not started?
Just drifted off.
Dr. Meyer has called in extra help to attempt the physically difficult hip relocation.
So there's two people pulling in exactly opposite directions. One pushing down to keep the pelvis down, and one pulling up to pull the hip joint back into place. You can imagine to get it go back in requires a lot of force, because at that point, once it's out, the muscles around it spasm. So what we're trying to do is to use drugs to relax the muscles and the body.
But there are risks with giving sedatives. Jack could stop breathing.
Just another 50 of propofol.
Are you in?
The team's struggling, so veteran emergency doctor Jonathan Papson arrives to give them a hand.
Jack's a big guy, so when I go in there, my eyes are rolling in my head thinking, oh, this is going to be hard work. Do you want me to press on the pelvis? Yeah.
Do you want to move him over a bit, guys? Do you want the bed down? Go for it, go for it. You're just going the end. Yeah. Push them both together.
Oh, it's rolling away. Put a bag there, please.
So I'm ready to see.
Hello, Freya. Hello, darling. How are you feeling, sweetheart?
Heavily pregnant Freya's fully awake following the procedure that pulled her dislocated shoulder back into place. Dr. Michelle Thornhill and her team can now perform an ultrasound to check if the unborn babies have been affected by the anaesthetic.
And don't forget, they might be a little bit sleepy at the moment with that medication we gave you.
It's a nervous wait for Freya and her mum Janet.
That's a limb stretched out somewhere. You're getting some movement there. So I think you're good. So I put the ultrasound on her belly. You see them moving and kicking and doing their thing. And we know that's our marker saying that they're fine.
How are you feeling?
Yeah, heaps better again. It's incomparable. Yep. And they're kicking again.
And they're kicking again.
They're kicking again.
It's good news for everyone. Freya's mum is hoping they can see the Harry Potter stage play in a couple of hours.
I've come with Freya for her last sort of hurrah before she becomes a mum herself. And because she grew up very much obsessed with Harry Potter, we thought we'd make the effort to come to the musical.
While Freya must be kept under observation for the next hour, Dr. Michelle hopes she's done enough to get the pair to their big night out in time.
I myself am a Harry Potter fan. I'm booked in to go see the live show in a couple months. It was somewhere in the back of my mind. I thought if we can get this done quickly, get her recovered well, then she should be fine for the show. We'll see.
So I'm ready to see.
Back in Trauma 1, a team of doctors and nurses are still struggling to get car crash victim Jack's hip into its socket.
When we go into a procedure like this, there's a risk we won't be able to move it back into the right place.
Dr. Jonathan Papson throws himself into the task, but he's worried time is running out.
You need to see to the hip dislocation quickly, because if it's out of the socket for too long, the hip head will actually degenerate. He's going to have a wrecked hip, he won't be able to walk. Oh, I can have a go. Sometimes, just some other position, isn't it? Sometimes. There we go.
Yeah.
I think so.
Yeah, does it click in?
Yeah, it's clicked. Whew. Good work. Good job. It's physically difficult to do. We effectively have to fight against the muscles until we find the right position where it clicks back. So that's what we're doing, which is hard because he's a strong guy. So we just want to re-X-ray it, make sure it's actually in. It felt like it clicked back in. Sometimes they click in and they click out again, or they grate just on the edge and they don't actually pop back. But I definitely felt a pop, so confident.
Dr. Jonathan appears to have finally gotten Jack's hip back in place.
Need a new bag valve mask and I need an airway nurse, please.
But without warning, there's a new, potentially fatal complication. Jack has stopped breathing.
Can you hook me up a CO2 that's in line?
You okay?
He is flat as a pancake.
The real problem now is that he's not breathing because we've given him so much sedation. So we just need to support his breathing until the anaesthetic wears off, essentially. To relocate a hip is a big deal because you need to deeply sedate the patient, and the deep sedation of a trauma patient is very dangerous. So you all right?
Started to breathe up on his own. Yeah, look at that. There we go.
With Jack breathing again, the team can check if his hip is definitely in its socket.
Yeah, we're okay. I think we're okay to put it back on.
So I can call a mobile X-ray. We can check this is in. If it's not in, we can keep playing, I guess. Yeah, that'll be fun.
The team anxiously wait for the X-ray. It's the moment of truth. Is the hip back in place?
Oh, beautiful. Beautiful.
It's all good.
Yeah. You're good.
So it's back in the joint now at least. So it's not dislocated anymore.
Now that Jack's awake again, he can have friends visit.
You're doing cartwheels in no time.
Before her shift ends, Maya debriefs with Jonathan.
Thanks, Jonathan.
So was the hip in?
Yeah, the hip's in.
Yeah, thank God for that.
Yeah. What was your technique, Doctor?
Just
Give us your learning.
No, look, I just tried a few different angles.
Yeah.
And then it just kind of clicked.
Thanks
just
for
the right
popping your
position,
head in.
that's all right. Answer phone calls all day, put hips back in. What am I going to take? I'll take the hip any day. It's really satisfying to relocate a joint at the end of the day. Yeah, it's good stuff. It's nice to fix things.
Heavily pregnant Freya was discharged from hospital in time to make it to the Harry Potter stage play that night, with an intact shoulder. And fellow Potter fan Dr. Michelle took her daughter to see the show.
All right, code red, please.
Dr. Emma's aggressive stabbing victim survived the violent attack. Thanks to her team in emergency, he was rushed to surgery where the internal bleeding was stopped and his stomach repaired. He spent a few days in hospital before checking himself out. He didn't return for any of his follow-up appointments. Zach's hand was ripped apart when he tore it free from heavy industrial machinery at work.
We're going to throw the kitchen sink at you and try and do what we can.
Please do.
That'll pop in the back and then you just screw them on.
It's 1 week later and Zach's still in hospital.
Bit tricky with one hand.
His sister Georgia is a constant visitor.
It just clips in or what?
No, but I mean, apparently it does now. That works.
The young factory worker has already had 2 marathon surgeries in the ongoing fight to save his hand.
So they reattached my pinky, put the skin back on and all the flesh, just hoping that it would take. They took some veins from my foot to help get blood flow. I can't remember how many days after, maybe 4 or 5, they did another surgery.
All the flesh had died practically, so they've stripped it all back to bone again and put it inside of my groin. So it's, yeah, I know. It's pretty crazy what they can do with medicine. They're going to grow my fingers back.
Right-handed Zach still has a long way to go physically and mentally. The impact on his life and livelihood will be huge, but he still has more good days than bad.
I've been absolutely miserable a couple of days, but I know that if I don't keep my morale up, it's just going to get worse. I need to stay positive. So all the nurses and doctors, they're working their magic to hopefully save my fingers, so I'm not going to complain. Yeah.
Good morning, Rowan Hospital.
Royal Melbourne, Mike 15 here. We've loaded a 20-year-old male, 3 gunshot wounds to the lower back.
At the Royal Melbourne Hospital, an urgent call has come through from paramedics, rushing a critically injured gunshot victim to emergency.
3 individual forward wounds to his back.
Royal Melbourne received. We'll see you in 15 over. Thank you.
Senior emergency doctor Sarah Whitelaw needs to quickly pull together a trauma team, but high patient demand is stretching resources.
We've got 15 people currently getting prepared for the trauma, but we've also got another 30 patients waiting. That can be a bit of a challenge. He may need quite a number of significant procedures done down here.
Dr. Sarah has very little information about the victim's injuries, so her team's preparing for all possibilities.
I'll just ring the blood bank.
In a gunshot victim, the injuries can be really unpredictable because some bullets are designed to actually explode inside the body cavity and do the maximum amount of damage. And what I'm thinking is there problems with bleeding that we need to stop that's going to cause this gentleman to bleed to death within a matter of seconds to minutes?
With so many other patients needing help today, emergency nurse Maddie White has only just left her last patient.
This place is nuts. It's so important to do 100% all the time and not get compassion fatigue and not, give everything to one patient and not give anything to the next. You have to give everything all the time. I began my nursing 4 years ago in rural Victoria, little country town emergency department. It's about 8 beds. Comparing the difference, rural Melbourne is huge.
The gunshot victim arrives under heavy police guard.
So if the police are here, what are we doing about security?
The shooter is still on the loose, and there are fears he may try to get to the patient in hospital.
1, 2, 3. That gunshot went off for a reason. What was that reason? Am I in a dangerous situation right now?
There are security concerns with that patient.
Hello, it's Jonathan Papson, emergency.
It's a hectic day in the emergency department, so Senior Dr. Jonathan Papson is having to juggle treating patients and answering phones.
Yeah, it doesn't seem to run at all. He's given me the phone, it's ringing hot. I don't really like it much because I'd rather just be seeing the patients and sorting them out rather than being on the phone all the time. My main aim now is to get rid of that phone. It's crazy, the sort of stuff I get, how far is Royal Melbourne from the market or something? It's just the weirdest sort of stuff. What's the waiting time? I mean, I don't know any of that stuff. That guy in Resus 5 is very interesting.
Dr. Jonathan's next patient is critically injured football player Mitchell. He's been brought in after copping a sharp knee to his side during a footy match.
He's got acute bleeding internally. It looks like his kidney's been badly damaged. He's got blood tracking down the abdominal wall. His blood pressure's low, he's shocked.
Dr. Jonathan needs to move quickly if he's going to save the 22-year-old's life.
Has he had something for the pain?
Yes.
So the kidney looks mush. I'm going to get some more ultrasound juice and I'll show you what I'm seeing. He's bleeding. What's the worry? Bleeding to death. That's what the worry is. Something unexpectedly bad is going on with Mitchell. So already I'm thinking, this is a big problem.
How long does fatal?
Instantly. So if you're still sore, you need more. So let me just show you what I'm seeing so you have an idea. So this is actually worsening. I see a whole lot of badness, which is hard to characterise on the ultrasound. Really what we need is a CT scan. Oh, he's next to the scan, is that right?
Partner Olivia is racing to be with Mitchell, but he's deteriorating fast. Dr. Jonathan needs to get an urgent CT scan to pinpoint the bleeding.
Let's go. I don't know how this other patient beat him to CT.
But there's a problem. There's a queue for the CT scanner. Dr. Jonathan and Mitchell have to wait.
At 5 o'clock, traumas all come at once, right? So this is what's happening. So we've got someone who's multiply injured who beat him to the scanner, and then some other guy sneaks in, knee in the abdomen. That doesn't sound anywhere near as dramatic, but he's got the real deal going on. He's bleeding to death.
Back in Trauma 1, Dr. Sarah Whitelaw's emergency team is treating a 20-year-old gunshot victim struck by a hail of bullets at close range. Dr. Sarah's concern isn't only for the patient.
And one thing that's really important is whether or not there's a security risk to our staff and the other patients in the hospital.
It's warm. It's such a very unknown, heightened experience to be in.
Paramedics who rushed the gunshot victim to emergency are giving Dr. Sarah and her team vital details about his injuries.
He's been shot with we think a small caliber gun. 3 gunshot wounds. He's pale, sweaty. He feels a little bit short of breath and has been grunting at times.
With a gunshot wound that's high velocity, high force, it can cause almost any type of internal injury. It is a life-threatening situation.
We're just going to roll you and have a look at your back, OK?
The emergency team is searching the man's body for bullet entry and exit wounds.
So, got a entry wound right mid-thoracic, just off the right of the midline. Right loin, 2 on his left thigh, 1 on his left calf.
They identify 6 visible wounds. But worryingly, not all the bullets are accounted for.
X-ray there, guys.
An X-ray reveals a potentially fatal injury.
That's one of the bullets that's still left in this gentleman's chest. So this is his heart here, and it should be over in the middle of his chest, and it's not, it's squished over this side. So this lung has collapsed down quite significantly. And then the question is, has another of the bullets gone into the abdomen below the diaphragm, and is he bleeding from anywhere?
The bullet in this patient has actually punctured the lung, and the lung itself is deflated and it's leaking air into the chest cavity. It's really important that we go in and make a small hole through the chest wall and release that air and any blood that's in there so that it stops squashing the lung and the heart towards the other side of the chest. This is something that could definitely kill this patient if we don't release that pressure.
He's become tachy?
Yeah, very, very tachycardic.
We didn't know where the other bullets were, so if there was any injuries to his neck and to his spine, that's going to stop his breathing immediately.
As the doctors make an incision for the drain, the patient's heart is starting to beat very fast. His collapsed lung is losing air and pushing harder against his heart.
Just going to give you some more oxygen, OK?
Essentially, more and more air has come from the damaged part of his lung into the chest cavity, and that has pushed his heart over further, and eventually those blood vessels to and from the heart would have become so kinked that his heart would stop beating and he would die.
OK, so everyone ready?
Are you guys ready?
1, 2, 3. Well done.
Following a spike in trauma cases at the Royal Melbourne Hospital, Dr. Jonathan Papson's patient, footballer Mitchell, is finally getting a CT scan. The 22-year-old has potentially fatal internal injuries. after colliding with another player on the footy field.
Your ongoing blood loss is deadly. It's what kills people in trauma. In this case, he's bleeding to death, and he's bleeding quickly, which is why I'm so worried. He's had tons of morphine. Doesn't seem to help. He's in a world of pain, but he's too sick to be able to tell us, which is even worse. There looks like free fluid on the fast, though. The kidney looks damaged, but there's free fluid on ultrasound now as well.
Dr. Jonathan believes the kidney damage is critical and urgent surgery is Mitchell's only chance of survival.
I'm hoping just to go straight to theatre from here. The liver's flapping around in a sea of blood. I'm not a surgeon, so I don't have the ability to do the operation. All I can do is advocate for what I believe is the right thing.
While surgeons review the scans, Mitchell's partner of 3 years, Olivia, is anxiously waiting. As Mitchell's condition is so serious, she hasn't been allowed to see him yet.
I'm just heartbroken. Heartbroken that this has happened to him, not actually seeing him, being with him, knowing in myself that he's okay.
It's definitely weird.
I'm hesitant to operate on this guy. If we do, he will lose a kidney.
Mitchell's been playing Aussie rules since he was 9. The removal of a kidney could mean the end of his football career.
He hasn't been well looking at all. It's been ashen, looking sick, blood pressure 90, heart rate 115. But I don't know, have you looked at him? He looks like shit. Gut feeling is, I reckon, go to theatre. Yep, thanks. The worst case scenario is he continues to bleed through this kidney that seems to be ruptured, and he bleeds so much that he goes into cardiac arrest and loses his life.
Don't break it in half.
Perfect.
All right.
You've been wonderful.
You're very welcome, not at all.
Registrar Michael Dunn's been a doctor for 6 years. He's halfway through his emergency specialist training, which he began back home in Ireland.
I do remember the first day of my job. It was absolutely terrifying. I remember being asked to put a drip in someone's hand and taking half an hour to build up the courage to actually do it. Probably shaking like a leaf. I'm sure they were more scared looking at me than I was.
Dr. Michael moved to Australia 2 years ago and loves the unpredictability of the Royal Melbourne's emergency department.
1, 2, 3.
What comes through the front door changes every day. We see probably a new patient every 30, 45 minutes, and you have to sort of be prepared for anything that walks through the door.
Pregnant trauma, do you want me to describe that?
Dr. Michael and nurse Lucy Stranger are heading up a team getting ready to receive a young pregnant woman injured in a car crash.
This is a pregnant trauma with vaginal bleeding, which is never a good thing. Try and prepare for the worst.
The accident happened more than an hour ago, so they must quickly assess both the 23-year-old and her unborn baby.
Kayla's currently 27 weeks gestation, first pregnancy. She's been struck by a four-wheel drive that was going past with a large bull bar. Probably compressed about half of the engine bay on the driver's side. It spun the vehicle about 90 degrees. She says that she struck her head on the windscreen. About 20 minutes before she got in the car was the last time she felt any fetal movement.
Kayla was leaving her local supermarket when the other car smashed into her. Partner Joe's now on his way to be with Kayla, who's 6 months pregnant with the miracle baby doctors said she'd never have after battling cancer.
Past history of osteosarcoma. She's been free of cancer for the last 3.5 years.
Osteosarcoma is a type of bone cancer that we sometimes see in the long bones, like in the legs and the arms. And in Kayla's situation, she's had 2 osteosarcomas removed, one on her right leg and then a few in her ribs as well on the left-hand side. As a result, she's had some prosthetics put in, a metallic prosthetic in her right leg and also some concrete prosthetics in her left ribs.
Kayla, I'm Lucy, I'm one of the nurses. How are you going?
You've had better days. Yeah.
I've personally never seen anything like this before, so it's quite a unique circumstance that we're dealing with. So for Kayla, we'd assess her like any other patient, checking head to toe to make sure that she's breathing okay, the lungs are okay, and also looking for any signs of significant bleeding. Sorry, dear, we'll look at the tummy now, okay?
She's got generalized lower abdo tenderness.
One of the concerns we have is that there may be some fetal distress, and that's what we use to describe a baby who's struggling. The placenta can tear away from the uterine wall, and that can lead to significant bleeding, which puts both the mum and the baby in danger.
That's one of the bullets that's still left in this gentleman's chest. This is his heart here, and it should be over in the middle of his chest, and it's not, it's squished over this side. So this lung has collapsed down quite significantly.
In Trauma Room 1, Dr. Sarah Whitelaw's team is carrying out a life-saving procedure on a gunshot victim whose lung has been pierced by a bullet. Police guarding the patient are on high alert as the shooter is still at large.
What we need to do is actually make an incision to drain the blood and let that lung fully re-expand. And we need to do that pretty quickly.
He's sore, that's hurting him. We need more analgesia.
It's painful to have this done. This gentleman's probably got a lot of muscle, and that makes it quite difficult to actually get in through to the lungs. There's quite a lot of blood coming out of his drain in the chest.
With gunshot wounds, you always have to expect the worst case possible. You know, some will enter and they don't come out, or they'll enter and then shrapnel just gets spread in their body.
And they don't have any exit wounds.
There's no exit wound.
It's very likely that there are still full bullets or fragments of bullets still left inside this patient.
Dr. Sarah's calling in a specialist surgeon to remove any remaining bullets in the operating theatre.
Sarah Whitelaw here, one of the ED consultants. We have a 20-year-old gentleman who, within the last hour, has had 6 gunshot wounds. He's having a chest tube put in on the right.
The gunshot victim needs a CT scan urgently to locate the bullets in his body.
You comfortable, Annalise, with that plan? If he stays as stable as he is, that we will go to scan?
I just want to know where, because if he's got a penetrating, he's got a gunshot to his abdomen, chest tubes, haven't had a chance. Absolutely.
It's just impossible to tell from the bullet hole itself whether that bullet's gone up that way or that way or that way or that way. So if it has gone into the abdomen, then there is a chance it could be causing bleeding. We need to keep the momentum going and get him to CT.
Moving the patient just a few metres from the trauma to the CT scanner is potentially deadly.
If that tube falls out or kinks, that lung could collapse again, and that could cause the patient to become very unwell or even die.
Sorry, dear, we'll look at the tummy now, okay?
Over in Trauma 2, Dr. Michael Dunn is performing an ultrasound on car crash victim Kayla to see if her baby is in danger.
The abdominal fast is okay. I'm just checking the pericardial views. Could feel a heartbeat as well.
The first-time mum-to-be hasn't felt the baby move since before the accident.
Did you say you know the sex? Yeah, a boy. Yeah. Oh.
When we do the ultrasound and see, is there a fetal heartbeat? Is it fast? Is it slow? But it's very scary checking to see that, and particularly if you can't find the heartbeat, something that's very difficult for Kayla and very difficult for the staff as well, not knowing if we'll find a heartbeat or not.
Kayla's waiting for a sign that the baby doctors said she'd never have because of cancer treatment at 19 is safe.
There's no obvious bleeding anywhere.
Good.
So, did you hear that? There's no obvious bleeding down there, which is really good. And the heartbeat looked nice and strong. You're going to get some x-rays. And then we're going to probably go get some scans just to make sure that everything in you is good. Okay, beautiful?
Yeah.
Now,
Anyone found Joe?
he'll be in the waiting room. So I'll bring him up as soon as all of this faffing about is over, because there's too many people.
Kayla will have to wait to be reunited with her partner, Joe.
Put your arm by your side for me.
She's not out of danger yet. X-rays and scans are needed urgently to check Kayla's leg and artificial concrete ribs for fractures.
Can you shut your eyes?
Nurse Lucy goes to find Joe, who's arrived at the hospital, still in shock over his partner's accident.
Hey, mate. What's your name?
I'm Joe.
Hey, Joe, I'm Luce. I'm one of the nurses. I'm looking after Kayla.
Oh, yeah. No.
Yeah? How you going, matey? All good?
Fine, yeah.
Yeah? OK. Do you want to go up? Do you want to go up?
Yeah.
Yeah, let's go. Family is very important to someone who is unwell. If you've ever felt any form of fear, you instinctively want someone close to you. Look who I've got. You're right, darling. Really? Yeah, we'll give you some more medication.
Though Kayla's been cleared of any internal bleeding or harm to her baby, the CT scans reveal another problem.
The CT scan did show that she had some fracture or a break to her prosthetic cement ribs. So we'd have to speak with the cardiothoracic surgeons and get their opinion as to whether there's something that needs to be operated on. It'd be quite an extensive operation and may actually lead to complications for both Kayla and the baby. Given Kayla's history, I say she probably thought her scariest moments in the hospital were behind her, and having to go through this again when she's pregnant must have been quite an ordeal for her.
Kayla will have to spend the night in hospital while she waits for the surgeon's decision.
Next waiting.
Every day, more than 200 people visit emergency via the busy triage station. This evening, Nurse Julia Hoyles is working the desk, assessing patients and prioritising who gets seen to first. She's been an emergency nurse for 5 years.
Just behind that purple line.
I like doing the triage. It's one of those places where you never know what you're going to get on a given day, and it's full of chaos, and that's what I love about it.
What's up?
I've had enough waiting here, love.
I know.
With so many people needing attention at the moment, Nurse Julia is dealing with increasingly agitated patients.
We're doing our best to get you in, okay, but it's pretty busy today.
Well, why did you bother me? You got so many things
I know.
How do I
Hang
thank
tight.
you?
Just be patient a little bit for me while I see if I can find a room, okay? Yeah? Very good. I'm just going to do a quick sweep around, make sure no one's left.
With beds in short supply, Julia is checking if any patients have vacated valuable spots.
The extra spare beds. I got very excited, but some of them need flood washers, so there'll be another 20 minutes or so before we get use of them.
It would take just hardly 60 seconds.
I understand that, but something like a tetanus injection isn't the highest on the priority, so we will get to it when we can.
No, so you're saying tetanus is not a serious thing?
Not a life-threatening emergency in the next 5 minutes.
But just as triage is becoming overloaded, security cameras show a potentially critical situation unfolding. A nurse sounds the alarm, and emergency staff rush to a woman who's collapsed at the triage window. The cause is unknown. Emergency physician Dr. Michelle Thornhill reacts to the alarm immediately.
When a buzzer goes off, we all know what that means. It means someone's in distress. So we all look outside the cubicle, see where it's happening, and I'm the closest doctor there. So I stop what I'm doing and I run out to the waiting room to see what's going on.
1, 2, 3.
I find a young woman in convulsions. So I immediately run to her assistance, support her head. I'm thinking she's having a seizure.
Have you got her?
Yeah, I got her. So a seizure can last anything from a couple minutes up to more than 15 to 20 minutes. If it goes longer, she's at risk of not breathing properly, not being able to swallow and choking.
Before she started convulsing, the young woman told staff she'd been having seizures earlier in the day.
Okay. She had 2 seizures today, witnessed by a friend. And then this is all I heard. Okay. And then we pressed the button.
The young woman is coming out of the seizure disoriented and confused.
Okay, we'll need to get some blood tests.
We're at the hospital.
Can you hear me? I'm Michelle, one of the doctors.
You're okay. It's all right, we're just at the hospital. Thank you, Jessica.
Jessica is a student from Chicago and right now probably feels a long way from home.
I'm starting to check her vital signs.
Sorry, Jess, just open your eyes, all right? Just doing a quick thing.
I get the nurses to attach all the monitors to her. I make sure that she's breathing well and getting enough oxygen. And then I start doing my investigations. So I take blood tests and order CT scans. Can you tell me what medication you're on for seizures? Do you know? Which ones are you on?
Jessica's having difficulty speaking because she's bitten her tongue during the seizure. So it's hard to get her medical history.
Just relax, stay nice and still. I'm going to take a tracing of your heart, okay?
Okay, was that your friend that brought you in? Yeah? Okay.
Jessica came to hospital with her friend Sarah, a German exchange student.
So we were in her room and she had an issue before. We're just waiting and then I called her mom and she said maybe it's better when you go to the hospital, and then we came here.
Do you got something for this?
Both young women are far away from family and have bonded quickly.
What's the code? So I'm just since 5 weeks here in Melbourne, so I know her since 4 weeks now.
While Jessica gets support from her friend, Dr. Michelle is still concerned that the cause of the student's seizures remains a mystery.
I'm hesitant to operate on Sky. If we do, he will lose a kidney.
Over in Resource 5, Jonathan's patient, footballer Mitchell, is still critical after he took a forceful blow to the abdomen during his regular weekend match. He'll die if he's not operated on immediately. Mitchell's fate is now in the hands of trauma surgeons Dr. Alastair Rowcroft and Dr. Ben Thompson.
Mitchell, will you tell me, is that okay?
Yeah, sure. If you push harder, it's going to kill me.
Don't worry, I'll look after that.
Yeah.
Okay. All right, we're going to get you sorted out. We're going to get some things arranged, make some plans upstairs, okay? Okay.
Surgeons are considering the removal of Mitchell's ruptured kidney, which could end his football career.
You never want to lose a kidney or a solid organ. But if it is that's what has to happen to stop the blood loss, then that's what has to happen.
Have you been updated? Do you understand what's going on?
Yes.
Mitchell's partner, Olivia, has been waiting for more than an hour to see him. Before heading to emergency surgery, Dr. Alastair tells her about the risks.
His right kidney is shattered.
Right.
Okay, so that causes a large amount of internal bleeding that needs to be controlled. That if you're untreated, you'll die. Great. So you go and have a chat to him. Okay, I'll be with you in a sec. Yeah. Go ahead.
Dr. Ben is head of the surgery department.
Just want something to see, all right?
Yeah,
So, of course. So, I know it's stressful.
So he'll stay here tonight then?
He'll be here for a while. Okay? You're all right, I'm sorry.
No.
It's all a bit frightening.
Yep.
Olivia steals one last moment with Mitchell before he's taken away.
They're telling me, he's got internal bleeding, so it's very important that he goes into surgery now. So you only have, 2 to 3 minutes to be with him. I just had to say goodbye, and, when you love someone so much, you just couldn't comprehend what was going on.
We have a gentleman who, within the last hour, has had 6 gunshot wounds. He's having a chest tube put in on the right.
Earlier, Dr. Sarah Whitelaw's team performed an emergency procedure to save the life of a 20-year-old gunshot victim. He was shot multiple times at close range and rapidly deteriorated with a collapsed lung.
X-ray there, guys.
An X-ray showed a bullet pierced his lung, but not all the bullets have been accounted for.
Walked for 10 or 20 metres after being hit and then kind of collapsed down. So I don't think he's...
We're very used to dealing with patients that can't give us a lot of history. So it is useful to be able to get information about perhaps the type of bullet. It gives us information about the damage that bullet might do.
That confirms what we saw on ultrasound.
The CT scan reveals the dangerous extent of the damage the bullets inflicted on the victim.
The CT confirms that the chest drain is in the right place, that there is that ruptured lung and there's a bit of bleeding from the lung. There's also quite a few bullet fragments in the chest itself, along the surface of the ribs, and some bullet fragments around the liver as well. So it's hard to tell how many bullets are in the chest and the abdominal cavity because there's lots of fragments everywhere.
The police are obviously very keen to get the bullet.
There'll be a couple.
So they're.
Dr. Sarah is handing over the patient to surgeons who will operate on him immediately.
So I think he's going to theatre for a laparotomy.
After a marathon shift, Sarah can finally head home.
That's one of the things that I love about emergency medicine. Most of the time we manage to make things a bit better. Sometimes we make it a lot better and sometimes we save lives.
Right, I want you to just squeeze my fingers for me. As tight as you can, squeeze, both sides. That's it.
2 hours ago, 20-year-old Jessica, a student from Chicago, collapsed in the busy triage waiting room. It was her 3rd seizure for the day. And alarmingly, doctors still don't know what's causing them.
Did you have any headaches or anything today?
Jessica bit her tongue during the last seizure, making it hard for Dr. Michelle to get the information she needs.
Do you know when's the last time you had a seizure? Before today? 8 months ago? So seizures are totally draining on a person having it. It's their whole body that's convulsing. So practically every muscle in their body is going into spasm and out of spasm repeatedly for minutes on end. They're really tired, they're sore all over. Probably akin to someone who's just run a marathon and have used every last bit of energy that they had, and then they collapse at the end because they just have nothing left.
Jessica was brought into hospital by German exchange student Sarah. Both young women are far from home, and it's times like these Jessica needs a friend like Sarah.
I come from the Caribbean. I can definitely relate to being on your own. I mean, I came out here essentially on my own. So yeah, I do know how important it is to have people who care about you close by. And if those people aren't around, then it's good to have other caring people there who can offer you that sort of reassurance and comfort in your time of need.
Hello, Grace speaking.
Nurse Grace Curry tells Jessica's worried mother in Chicago that her daughter will have to stay in hospital.
Especially since she's staying in student accommodation by herself, I think it's more likely that we'll keep her overnight for longer just to make sure that we're not sending her home by herself to no one.
Jessica's still in danger of having another seizure, so hospital staff need to monitor her overnight.
People can die from a seizure. especially if it's a prolonged one and that's not recognized. Because sometimes you can stop the actual body convulsions, but there's still abnormal activity going on in the brain if you don't wake up.
I poked my head in here before and you were asleep, and then I poked my head in a little bit later, and there's Joe eating breakfast off your stomach, and I was like, Joe?
Nurse Lucy's patient, Kayla, was at risk of losing her 27-week-old baby after being in a car accident. Yesterday, Dr. Michael cleared the unborn baby of any harm. But X-rays revealed Kayla's concrete prosthetic ribs, which were the result of her bone cancer, had been fractured in the car crash.
How's your ribs?
Yeah, it's better.
Yeah? No.
It's still tender, but it's not.
It's been an anxious night for the young couple, waiting to hear if Kayla will need surgery to repair her ribs.
Fortunately, in Kayla's situation, the cardiothoracic surgeons assessed her and they felt that the actual plate itself had maintained its structure and wasn't actually at risk of causing any long-term problems. So fortunately, it didn't have to be replaced or repaired.
There's a bit of a special bub then by the sounds of it.
After Kayla's battle with cancer and surviving a car crash, the couple are looking forward to the birth of their first child.
See you, beautiful. See you, Joe. All good, babe.
For Kayla and her partner, Joe, being so young and starting a young family must be quite an ordeal. We see patients at a point in their lives where they're most scared and most afraid, and we have the knowledge and ability to reassure them and put them on the right path, and I think that's a very rewarding aspect of the job.
3 months down the track, Kayla is now a mum to baby Noah.
That's hurting him. We need more analgesia.
Dr. Sarah's gunshot victim's life was saved after surgeons removed multiple pellets from his chest. They repaired his diaphragm, which had been ruptured by a bullet, a hernia, and part of his liver, all complications from the gunshot attack. He was discharged a week later. After suffering 3 potentially fatal seizures in one day, Dr. Michelle's patient, exchange student Jessica, was kept overnight for observation.
Can you tell me what medication you're on for seizures, do you know?
The next morning, Jessica remembered she missed taking prescribed medication before the seizures. She was discharged the next day and has returned home to Chicago. Friend Sarah is continuing her studies in Melbourne.
What's the worry? Bleeding to death.
Dr. Jonathan's patient, footballer Mitchell, was dying when he was rushed to surgery with a ruptured kidney and internal bleeding after colliding with another player on his local footy field.
Seeing him laying down, I just couldn't contain it.
It's several weeks later, and Mitchell is recovering from major surgery that saved his life.
I've probably been hit like that, 100 times before, but it was just happened to be in the wrong spot, the wrong time. And it was just kind of a bit of a freak accident.
They took the kidney out, it was completely ruptured. I've got a big scar from here to here.
You can pretty much live a normal life with one kidney. In terms of my health, I was pretty happy with that, that there's no serious consequences to what had happened.
For the young man who's played Aussie rules every week since he was 9, it's been a life-changing injury.
The doctors kind of said it might be best to hang the boots up and not play again because I've only got one kidney left now and don't want to risk it too much.
It's a life changer, it's a massive change to my life.
What's going on, bro? There you go, man.
What's happening, boys?
Mitchell's staying positive.
I'm going to miss going out playing footy with my mates, but I just want to try and hang around the footy club as much as I can and just stay involved, and because I do love footy.
Take care of yourself, bro.
These days, it's all about how good their voice is and the singing stuff, whereas it used to be more poppy. Dancey, poppy, sort of crazy, funky Euro stuff.
Rather than artistically.
Now it's more, I don't like that.
At the Royal Melbourne's Emergency Department, Doctors Sarah Whitelaw and Jonathan Papson are taking a rare break between cases.
Well, yeah, that doesn't sound like he should have won the popular vote.
He was the favourite.
I think that we enjoy working in a team. We enjoy the contact and the conversation with the colleagues that we have to have so many conversations and different type of relationships with throughout the day.
Up above them, on the hospital rooftop, an air ambulance is landing with a badly injured patient from country Victoria.
A trauma alert has been put out.
The emergency team swing into action, preparing for the worst.
I just can't get you some long bandages.
Even though Dr. Sarah has almost 20 years of trauma experience, she still gets anxious when a new case arrives.
I think we enjoy really bringing order to chaos. So it's that knowledge and that adrenaline that you get, and it sometimes can be a real fear. I still have butterflies going to work.
A gentleman has had a chainsaw injury to his head. The laceration is about 25 centimetres long. We want to make sure that we're set up to manage all the complications of a chainsaw injury, which might not just be an isolated head injury.
61-year-old Mark was using a chainsaw to trim branches on his rural property when the accident happened.
Initially, I'm worried about, is he actively bleeding an enormous amount of blood? And then I'm really worried about a brain injury.
A chainsaw through the head.
Nurse Lucy Stranger has arrived at work just in time to help Dr. Sarah and the team.
And you'll get in some bloods.
Mark is conscious and in shock.
That's shivering, just shock shivering.
This is Mark, 61, he was operating a chainsaw, was unseen, believed to have picked up and struck him right on the top of the head from the hairline back 25 centimetres and opened up about a 3 centimetre gash. He was found by his friends in an altered conscious state. They stemmed the wound. They didn't describe it as spurting, but heavily seeping. The only strange thing is he's very hard of hearing. He says that's new.
How are you feeling?
Sore.
Yeah, where are you sore?
Middle of my back, top of my head, back of my neck.
What we don't want to do in a case like Mark's is get distracted by the fact that he's got a very big cut on his head. If it's not actively bleeding and he's not literally bleeding to death on the floor, then we're probably going to ignore that until we've made sure that other things are stabilised.
Dr. Sarah's priority is an ultrasound to see if Mark has any life-threatening internal injuries.
I know you probably can't hear me. Yeah.
Sorry.
I said I'm going to do a scan of your tummy just to make sure there's no injury to the tummy because it sounds a bit unclear exactly what's gone on. Deep breath in. Good man, good man.
If we find evidence of a ruptured lung or bleeding around the heart or bleeding into the abdomen, and if we don't address that, then that's something that can cause someone to die within minutes.
What are you doing? You right?
Yeah, trying to get...
Dr. Fiona Nicholson has spent her entire career at the Royal Melbourne, treating whoever comes through the emergency doors next.
I've been at the Royal Melbourne for 26 years as one of the, I hesitate to say senior, doctors in the emergency department. Makes me just feel old, but yes, it's still something that I enjoy doing.
So I think you're actually fine, but if it was a stroke, that would be a bad idea that you didn't turn up yesterday. And if you thought you were having a heart attack, it was an even dumber idea, OK?
While Fiona has a no-nonsense approach to her patients, the job can still get under her skin.
I know everybody always thinks, oh, you know, I could get hit by a bus tomorrow, but it would never happen to me. I see the person who got hit by a bus. I do think it can happen to me. You know, things can change at a minute's notice.
In Resus 5, Dr. Fiona is responding to the emergency buzzer for a young man whose heart is racing out of control. She must act quickly to save his life.
What's your name, darling? Say that again.
Rail.
Rail, is it?
His heart rate is running at about 200 and second glance suggests that his blood pressure is about 80, both of which are really abnormal. What happened today?
I was stressed out, fighting with my girlfriend.
Okay. Has this happened to you before?
6 months ago.
Do you take any regular medication?
I stopped taking it.
Now, what were you taking, do you know?
I can't remember.
I'm just trying to get a blood pressure first, and then I'll get that second line.
35-year-old builder Rael's heart rate is more than double a normal resting rhythm.
When your heart's racing at 200 beats a minute, the heart barely has time to fill with blood before it's pumping again. So his blood pressure's really low, which has the effect of making him feel like he's about to faint constantly. How long have you been in this rhythm? How long ago did it start today? Sorry, Dale. When did it start today, Rael?
About 9 o'clock this morning.
The heart is a muscle. It's running a marathon in there. It's already been fast for about 3 hours now. Occasionally people's heart does stop because it just gets tired. So if we don't do something, something will go wrong for Rael because your heart just can't keep beating that fast for that long.
Dr. Fiona's preparing to use a powerful drug, which Rael's been given before. It's a drastic solution, and he's dreading it.
So we use adenosine, which in theory stops your heart, the transmission from the top part of your heart to the bottom part of your heart for 3 seconds, makes you feel like you're going to die. Yeah, okay. And then your heart starts again, okay?
Do I have to be conscious?
You do have to be conscious because otherwise I don't know if it's working or not. Okay? Sorry, Dom.
Sorry, that thing's freaking
Yeah,
out.
no.
You never go.
If the drug fails to stop Rael's racing heart and reset its rhythm, the only option is an electric shock.
Will someone grab that ECG, please? I'm going to shift these pads on your chest so should anything happen, we can shock your heart. So let's just reposition all of this and get them in the right spot.
You have a really fine and comforting week. Thank you.
I'm going to hold this while we get
My pleasure, darling.
wax.
Sorry, more free waxing coming up. I'll be as quick as I can. That's it. Going to sit you up for a minute, sweetheart. Just for a sec while I put this on your back, okay? That's it. Back you come. Well done. What we're going to do is a dose of the adenosine.
If it works, the drug will stop Rael's heart for several seconds, and he'll feel like he's dying.
So you're cool, Rael. You know what's going to happen, okay? His heart will eventually tire, and the consequences of that is that it can just stop, and if your heart stops, then that's fatal.
Oh, God damn. You found that damn thing yet?
I'm going to roll you to your left-hand side.
In Trauma Room 1, Nurse Lucy Stranger is caring for chainsaw victim Mark, who's suffered a massive gash across the top of his head.
The doctor is going to poke down your back. Say whether it hurts or not.
No. No. No.
You're all done, Sal? Yep.
Nurse Lucy and Dr. Sarah Whitelaw examine Mark's whole body, and the only injury so far appears to be his deep head wound.
We're looking for things like, is the skull fractured? Are we able to see brain on view? Does this person need to go to the operating theatre straight away to relieve bleeding that's causing pressure on the brain?
So we're just going to take the bandage off and have a look at what's under the bandage.
The dressing put on by paramedics has to be removed carefully.
We do know that that bandage might be solving a lot of the problem of keeping the wound together, and when we remove it, that suddenly a whole lot more bleeding could happen.
How long does it, how far does it extend down the back?
All the way down here.
Okay. You can irrigate it a bit, but I wouldn't get in there with a syringe and really irrigate it. We can do that when we get back from scan. You're doing well. We're just putting the dressing back on. That big Mr. Bump dressing that you had on was great. We'll do another one of those.
It's a temporary fix before surgery.
I've got that neck, so you're right to feel a bit.
You're doing amazing. Penny, do you know what he was doing today?
Mark's wife Penny has arrived, and Nurse Lucy is making sure she's prepared for Mark's confronting head wound.
What he was doing with the chainsaw, I have no idea. Anyone's guess. We don't want him to move his head because we're just trying to protect his neck. Now his hands look gruesome. There's blood everywhere. Your head seems to do that. I know. Yeah, exactly. Right. Brilliant.
With the chainsaw.
No, other instruments. He looks messy. He's got a massive cut through his head. And if I saw that on somebody I loved, I'd be horrified. It can be really, really terrifying. Yeah, if you haven't been forewarned, that one moment can be quite haunting.
Mark?
Hello, darling.
How are you?
Can't hear you.
Okay, that's fine.
Sorry.
I'll bring it down here just so you can get into him.
My hearing is bad.
I know. I know.
Mark isn't good, and Lucy needs to get to him quickly.
You right, Pen? It's okay.
Burping. Mark,
Hi.
do you feel sick?
Yeah.
Yep, all right.
Nurse Lucy needs to roll Mark on his side to stop him from choking on vomit, which could kill him.
Do you want to come and tape up the back of this head? Well, don't touch the bandage if we can help it, but if you want to do a supporting bandage, great.
Mark's terrible wound is bleeding a lot, and it'll need closing in the operating theatre.
We're still unsure as to whether Mark's got a brain injury underneath that big cut. So it's important that he goes to the CT scanner first and see whether or not he's got a brain injury, particularly an ongoing bleed in the brain that's going to get worse. That's the thing that is a bit unknown at this stage.
Down the hallway in Resus 5, Rail's racing heart has been speeding at more than twice the normal rate for hours, and it's under enormous pressure.
Rail, we're going to go with the adenosine. You know what's going to happen?
Dr. Fiona Nicholson hopes to stop Rail's heart dead in its tracks for a few seconds by injecting him with a fast-acting drug.
The adenosine helps short-circuit the wiring system in his heart and potentially allow the heart to go back into its normal rhythm all of its own accord. It does make you feel like you're about to die. Okay?
Everyone's looking for a heart rate below 80.
So, nothing there, Rail? No. What do you want to do? Do you want to try 12 or do you want to go electricity?
I think his blood pressure's now 60, so I'm sure.
The drug isn't working, and Rail's blood pressure is plummeting. Dr. Fiona is forced to take extreme action.
Adenosine didn't touch anything. It obviously wasn't enough to get to you, or you're a bit too stimulated. So I'm going to make you asleep. I'm going to give you a shock while you're asleep. Okay?
Rail's given a sedative while the electrical charge is prepared.
Charge to 200.
Sync, charge to 2.
What?
Am I supposed to be out yet?
No. I'm not going to do anything till you're asleep. It's all right. I'll check in with you. Oh, it scared the crap out of you.
Don't talk about the bloody defib going down, right?
You'll know if you get defibbed. I think that knowing that you're about to get a current or a shock through your heart, that must be incredibly confronting and terrifying. Rail? Rail?
Before they can jolt Rail's heart to try and fix its rhythm,
Just going to take your oxygen off, darling.
Dr. Fiona must ensure he's completely unconscious for the risky procedure.
Rail? Yeah. Okay, you can go.
Oxygen's away. We're going to charge at 200. Right, we're at 200. Everyone clear.
It's late afternoon at the Royal Melbourne Hospital, and paramedics are rushing in a patient with potentially fatal head injuries.
This is Dean. He has had a full tonic-clonic seizure lasting a few minutes with multiple head strikes. Only medical history of epilepsy.
This sucks.
29-year-old Dean was on a first date with Olivia at a beer and food festival when their budding romance was interrupted.
He just went off to the bathroom and I just heard a big, thud and then a yell. And he didn't respond, so went into the bathroom and he was on the floor having a seizure. Bit scary to watch.
Don't be worried, I'm going to lose you. I'm not hearing a no, that's concerning.
The emergency department is the last place Dean was hoping they'd end up.
So much for a steamy shower session.
Hello there.
Nurse Julia Hoyles ushers the first daters to the treatment bay.
What'd you do?
I had a seizure and smacked my head.
Have you had one of them before?
Yeah, I've had epilepsy for 10 years, but haven't had one for a while.
If someone's had a seizure, they can hit their head on the way down and they can do some damage to the brain or brain bleeds.
So Dean, because we've got that collar on, we're going to slide you across to the hospital.
So we need to give him a top-to-toe examination.
Ready, set, go. And back, ready, set, go.
We're just going to change the collar, so I'm just going to hold your neck.
Dean hit his head several times during his epileptic fit and needs a CT scan to check for brain or spinal injuries.
No, thank you though. Because she comes here, she's just going to be super worried.
Under difficult circumstances, love is beginning to blossom.
Waiting for the clearance to go get the scans done on the neck and the spine.
It's awful with the wait times sometimes and there's not much we can do about it. He was just trying to concentrate on not being in pain and I'm sure he was trying to keep a brave face for his lovely lady as well. You've just gone to CT. Check the neck. All right, everyone, we'll roll on 3. 1, 2, 3. Back on 3. 1, 2, 3.
As Dean is rolled over, his neck pain is beginning to concern Nurse Julia.
Where's painful mainly?
That one just then was the neck.
All right, we'll try and be gentle, okay? On 3. 1, 2, 3. Very good. Okay? Sorry, mate. We're looking for any potential head injuries, any spinal injuries, as well as limb dislocations and fractures, brain bleeds, which is the worst case scenario.
Oxygen's away. We're going to charge at 200.
Over in the resuscitation unit, 35-year-old builder Rail is critical. His heart is still racing out of control and his blood pressure's plunged dangerously low. So Dr. Fiona Nicholson is about to deliver an electric shock to try and reset the heart's chaotic rhythm.
He's already quite compromised, so we're going to start with 200 joules and cross our fingers that one shock's enough.
Right, we're at 200. Everyone clear.
Press and hold. Once.
Press and hold.
Moaning. Braille.
Blood pressure cycling.
The shock treatment has worked. Rail's heart is now beating at a normal pace.
Hello, darling. We did shock you and you're good, okay? But everything is good. You're back in sinus rhythm and your blood pressure's good, okay?
So how many toilet roll holders are there?
How many toilet roll holders? Pass on the toilet roll holders. You've got one shock, which got your heart back into normal rhythm, okay? I'm going to keep you here for a little while and make sure everything settles down, okay? We often find as people wake up that they say some funny things half under the influence of anaesthetic. I get lots of marriage proposals at that point in time. Sadly, I wish that they would continue when they're not drug affected, but that's okay. Yeah, we're 90 now.
Dr. Fiona's concerned that Rails stopped taking his heart medication.
You do need to start accepting yourself so that the medication that your heart doctors give you, you continue to take. And then maybe we won't meet like this again. Okay?
Rail comes out of the anaesthetic well and full of admiration for the emergency team.
Fiona was amazing. Speak your doctor speak and then just translate quickly for the layman's lying here in the bed. Yeah, it was really appreciated.
Rail appears to have had a lucky escape, but in case his heart starts acting up again, he's being moved to the ward for observation, and heart specialists will decide if he needs surgery to fix his condition.
Royal Melbourne receiving.
Another air ambulance is inbound, this time with a seriously injured car crash victim.
Thank you, Hems 2. You are clear to land. Royal Melbourne receiving.
22-year-old trainee nurse Tale is being rushed by air ambulance to emergency. Tale dragged herself free from her smashed car despite being seriously injured. Passers-by then called for help.
How's your pain? Is it okay?
Dr. Michael Dunn takes charge of the trauma room as paramedics begin their handover.
Okay, this is Tale. Single car accident into a tree. Seatbelt worn, airbag deployed. Self-extricated and then fell to the ground when she realised she had some injuries to her left leg and pain to the left wrist. The ambulance crews bandaged and left the leg in the position found. It was very difficult to straighten it.
Excellent. Tale has come in after a major car accident, quite a high speed. While the knee is quite apparently injured and very deformed, we would mostly be concerned about fluid around the heart, collapsed lung, some bleeding around the liver or inside the abdominal cavity that we don't necessarily see externally.
Follow my fingers. Very good. Do you know where you are at the moment?
Yeah.
Well, Melbourne.
Sorry, dear. If I press there, is that sore?
Yeah.
That's very sore, is it?
Yeah.
The knee abdominally, is it though?
Yeah, like shoots to my knee, but it wasn't a couple of
No, sorry, it's not hurt a little bit.
Just a hard X-ray board, sweetie. Sorry.
Dr. Michael's so worried about Tale's left knee, he orders an immediate X-ray.
Good. Breathe away.
Tale, is it? From Tale's X-ray, it looks like she's got multiple fractures of her kneecap itself, and it's also penetrated through the skin.
The news is not good. The damage is so severe, it could put Tale out of action for months.
What you do?
Nursing.
Oh, really?
I know, I've got interviews coming up.
Not the side you wanted to be on, is it?
Tale was due to do her final hospital placement in just 3 days' time. Her dream job is now in jeopardy.
There'd definitely be concern from a nursing career perspective. Should be on her feet the whole time. Having a knee injury like that may lead to some long-term issues, particularly related to pain.
How far does it extend down the back?
All the way down here.
In Trauma Room 1, Dr. Sarah Whitelaw's still dealing with the huge gash on chainsaw victim Mark's head. The accident happened when he was trimming branches.
Ow. I know that's not super comfortable.
The gruesome wound looks horrendous, but it isn't her biggest concern.
In a big head laceration, once the bleeding is controlled, is there a significant brain injury underneath? And I'm also very aware that there might be a spinal injury associated, so making sure that we don't move that spine unnecessarily is really important.
61-year-old Mark is on his way for a CT scan. If his skull is fractured, there could be bleeding to the brain, all because of a freak accident.
All right, Mark, we're going to roll you like we did before. I want you to stay nice and still. We'll do all the work.
The CT doesn't show any signs of significant ongoing bleeding in the brain. What it does show is a neck fracture. So I'm very pleased that we had protected that neck. It also shows that he has a rib fracture and he does have a punctured lung on one side.
Mark's list of serious injuries is growing, and his wife Penny's trying to reassure him.
I'm buggered.
I know. That you're still alive, so that's good.
You can go.
I'm not going.
It turns out, Mark is a bit unlucky when it comes to heavy-duty tools.
He's put a pickaxe through his head before. They bounce, apparently.
The bandage covering Mark's head wound needs changing again. Penny doesn't want to look, but doesn't want to leave his side.
So no skull fracture or these.
He's losing a lot of blood from the head wound, and the bandages aren't enough to stem the flow.
We're going to staple your head back together.
Well, the sheet's absolutely covered in blood.
Yeah.
This time, the procedure's too distressing for Penny.
Keep your head really still, okay?
Stapling is an option that's very effective at closing the skin quickly and putting it under tight tension, which will put pressure on the blood vessels and stop the bleeding. We know that Mark has to go to the operating theatre. He's going to need that wound washed out and repaired in several layers, which will take a bit of time, but we don't have that time. We need to get on and stop the bleeding now.
Do you feel me touching the foot? Yeah. Good. Can you wiggle the toes at all? Just the toes, good.
Over in Trauma Room 2, Dr. Michael Dunn is assessing trainee nurse Tale's shattered knee. The 22-year-old crashed her car at high speed during her daily drive to her grandma's house.
She's got multiple fractures of her kneecap itself, and it's also penetrated through the skin as well. This will be one of the more dramatic fractures that we've seen.
You, with this hand, hold your bad one, and you pin it against your body, okay?
Even though it'll put great pressure on Tale's knee, Dr. Michael needs to roll her to check for other serious injuries.
The knee injury itself, it's very apparent and causing a lot of distress, but there might be something more serious going on. Might be a spinal injury, so we have to keep an overall picture.
1, 2, 3.
All right.
Doing well.
Any pain back here?
No.
Back here?
No.
And can you feel down below? Down here?
Yeah.
Okay.
You're taking this like a trip.
I was lucky that the first lady pulled up with a nurse.
Oh, really?
She's on her way to work.
This is all round, eh? All right, we're ready?
Yeah.
3, 1, 2, 3.
Ow.
Yeah.
Is your hip sore? No, my hip's sore.
Ruling out spinal injuries, Dr. Michael now focuses on Tale's broken leg, as she reveals there was another passenger in her car.
I had my cat in the car.
Oh, the cat. How's the cat?
I ran away.
Probably need a scarf her.
Tale's lucky to be alive, but she's realising the accident could change her future forever. Her precious cat is missing. Her nursing career is on the line, and it's uncertain when, or even if, she'll walk again.
I think Tale is fantastic. I think she's been managing very well. It's quite a traumatic accident to be in, with a lot of unknowns at this point in time, but she's been extremely calm and cooperative.
Dr. Michael's preparing to remove the bandage for the first time to see the extent of the damage to Tale's knee.
Okay. Ready?
Hold it there, is that okay? They're going to stop.
Tale's knee is badly fractured, with tiny bone pieces scattered throughout the wound. It's a huge mess that brings new dangers.
The main task we have to do with the knee is immobilize it and also to apply an antiseptic dressing. Unfortunately, we can't leave the knee in the position it's in, which is comfortable for her, because the bone fragments themselves sticking out are going to be a high infection risk.
All right, dear, I'm going to take control of your leg, okay? We'll move it nice and slowly.
So Dr. Michael must try to straighten Tale's knee without causing further damage.
Sorry. Hold it there. Is that okay? There goes.
But she's in too much pain and needs immediate help.
Now put your leg down for a second, and then we'll give you some more strong pain relief, okay?
Tale's given a sedative so Dr. Michael can begin the difficult job of cleaning her wound and trying again to straighten her leg.
Is she pretty out of it now? Yeah, okay. It's not much contamination.
Okay. Now, we're just going to try and straighten this slightly, okay?
Yeah, go for it. Does it feel locked or?
No, it feels tight.
It's really swollen.
It's probably straight as we'll get it, I think.
They've succeeded in getting Tale's leg into the best position possible. It's now clear she'll need major surgery if she's to walk again.
We have multiple fragments that we're trying to piece back together. So we'll plaster the fracture to keep it in place, and that will prevent any further injuries, but also will help reduce the swelling and probably give her a better outcome after surgery as well.
Sorry, sweetie, we're just putting a cast on there. Just try and keep your legs straight. I know it's really sore. It'll feel better once we're holding it really still with this cast.
Tale's leg is now set in place to stop any damage before surgery.
So scanner next.
Dr. Michael and his team have done all they can for Tale. She's facing months of recovery and rehabilitation before she can walk again. As his patient leaves emergency to await surgery, Michael can call it a day.
I personally love being a doctor. I am from a family of architects, and I was geared up to do architecture until I watched a season of Scrubs the day before I had to make my decision, and then decided that medicine was the way forward. The rest of my family in Ireland have no clue about medicine whatsoever. My dad was a little bit gutted initially, but nice to have someone in the family that can help them when they're sick. And my brother has a little niece now, and I get phone calls probably once a month with questions of rashes and things like that. So I have some use in the family, so they're pretty happy now.
Dean had an epileptic seizure on his first date with Olivia, banging his head several times when he fell in the bathroom.
Hey Ben, it's Julia around in 17. Just with Dean, we've just come back from CT. He's still got some pain, it's quite significant in the lower back.
Scan results are yet to come through, but nurse Julia Hoyles is concerned about the pain in Dean's lower back.
I felt like it was going from the base of my neck all the way through my toes. I never felt anything like it. Still can't move my legs too much.
It's now been hours since Dean's admission, and Olivia still hasn't walked out on their first date.
Not nice seeing him in pain, but awkward.
To stay in emergency for hours with someone you've just met, I think he's done pretty well. And I hope that there is a date too for them.
Dean flew all the way from Sydney for his date with Olivia and seems smitten, despite them loving rival Aussie rules footy teams.
Even when I move down here, I'm not going to stop supporting the Swans. Even though she goes for Carlton, I'm not switching.
So we're going to roll you onto your side and have a better look at your back and see if we can work out where this is all coming from, all right?
Dr. Ben Land has arrived to find out if Dean has sustained a spinal injury.
1, 2, 3. Sorry, Dean. Breathe, mate.
So sore head?
No.
Sore here?
No.
Don't shake your head, mate. Just yes or no.
No.
Sore here?
Yep.
Right here, is it?
Yep.
Okay. Sore here?
Yes.
Working in emergency where we're constantly surrounded by stress, people in pain, we've got to empathise with each patient and not just have patients as a number and really treat them with the care that they deserve.
All right, there's no major bruising or anything, but it is quite sore there. Okay, happy to go back.
1, 2, 3. Sorry, Dean. All done, mate.
I think, given that this pain is still quite bad in your lower back, I was hoping we could avoid it, but I think we'll go back and do some more scans of your lower back, all right? And just make sure there's no damage done down there. All right?
Olivia's marathon first aid in emergency isn't finished yet.
Hey, Dean, have you had morphine before, mate?
Yep.
All right, warm, funny feeling coming in 5. Sorry, mate. Deep breathing for me.
My legs are certainly relaxing. They're not shaking. I'm pretty sure, though, going on morphine rules out having a beer tonight.
Could have told you that about 5 hours ago.
With his pain under control, the Swans fan's thoughts turn to more important matters.
Can you please do me a favour?
Yeah.
Can you please look up when the Swans are playing?
I like that this is your priority right now. 7:25 tonight.
Sweet. Let's get out of here by 7 o'clock now.
Dean's being optimistic. He's still got to get the all clear from the scans. And then there's his date, Olivia.
So I don't think I'll be forgetting this one anytime soon. A first date.
The main question is, will there be a second?
2 days ago, chainsaw accident victim Mark was airlifted to the Royal Melbourne Hospital, hemorrhaging from a massive head injury. Dr. Sarah and her trauma team stemmed the blood flow by stapling his head together as a temporary measure before surgery.
I'm buggered.
I know. But you're still alive, so that's good.
Morning, Mark.
The 61-year-old is now recovering after surgeons repaired his head wounds.
I was just cleaning up some dead trees and doing a bit of work to make sure the place was safe. It's safe for everybody except for me. There's a fracture in my neck, there's one in my back, I've got a couple of fractured ribs. So I've done it pretty badly.
The good news is Mark's hearing has returned after it was damaged by the blow. He's also remembered how the accident actually happened.
I was cutting down a dead tree, and then I turned around and put the chainsaw down, and the tree had swung and then hit me.
So it wasn't a chainsaw that fell on his head, it was the tree. And being a world-renowned ecologist, he knows exactly what type of tree it was.
It was a blue gum, Eucalyptus globulus. It's very common on the Victorian coast west of Melbourne.
Go do the stuff today.
Rails racing hard was stopped and successfully reset by Dr. Fiona.
Clear.
3 days later, Rail is being released from hospital and he's taking doctor's advice to book in an operation to fix his heart's faulty wiring.
I'm now looking forward to getting home and getting back to work, and hopefully I won't give anyone dramas after that.
All right, the scan's all good here. I'm going to take this off and just get you to slowly turn your neck for me.
First aid Dean was admitted to emergency after collapsing and hitting his head while out with Olivia.
Can you turn your head all the way towards me?
Further scans revealed he suffered no permanent damage to his head, neck or lower back. He was finally allowed to go home late in the evening.
Can you please look up when the Swans are playing?
He missed the Swans game, but he and Olivia not only had a second date, Dean's now made the move from Sydney to Melbourne, and they're officially an item.
Sorry.
5 weeks ago, Dr. Michael's car crash patient, trainee nurse Tale, was rushed to emergency with severe injuries.
This will be one of the more dramatic fractures that we've seen, with multiple bone fragments sticking out.
Tale then endured a 6-hour operation to fix her ruptured knee. Now, Tale's back on her feet and on the mend.
You're up and walking.
The best I can.
Tara and Treen, the passers-by who stopped to help Tale after the accident, have popped by to see how she's doing.
To be honest, you're doing amazing.
To see you walking is just, I wasn't expecting to be able to see her up and walking.
Thank God.
After shattering her knee, Tale thought her dream of becoming a nurse was over.
I ended up still completing all my interviews. I just continued with all my coursework in hospitals.
Oh, that's wonderful news.
Yeah.
That's great.
So that's exciting.
Yeah.
Still going to finish.
What nursing do you want to go into?
I think emergency nursing I'm, like, interested in now.
Oh, that's
right,
wonderful.
Yeah.
And what happened to Tale's cherished cat, Meows, who ran away from the crash?
I saw her run across the road and I just couldn't do anything about it.
We did go looking for the cat, so we did have a bit of a look around, but no, there was no cat.
Yeah,
Was the
so
cat okay?
Saturday morning, a CFA lady picked her up. She was just sitting where I'd crashed and she just caught a glimpse of like her eyes.
Oh, wow.
I pulled over and kind of called out and she ran over to her. My lovely Meows. I just burst into tears. I was so happy that she was okay and that she'd been found.